Good afternoon. My name is Muqaddas Malik. Today we will be talking about evidence for effectiveness of cloth masks in the COVID-19 pandemic. This is a literature review that discusses how effective cloth masks are at reducing viral transmission. In the early pandemic, there was a severe shortage of N95 masks, also known as PPE. The CDC recommended that N95 masks be only used by healthcare workers. Um, N95 masks were at a short supply and became very expensive. And because reusing the masks is not a viable option due to the fact that isopropyl alcohol causes the filtration of the mask's ability to reduce by 65%. It was recommended for the public to not use them so that they are readily available for healthcare professionals. Individuals in the community therefore subjected themselves to using surgical, also known as medical masks for protection. This required that multiple masks per day be used because that is, as we will see later, the recommended way of using the masks. This caused a great deal of waste and an economic burden on some people. Cloth masks therefore gained popularity very quickly because of their fashion forwardness, practicality, accessibility, and economic benefit. People could easily make them from materials that they can find in their own house, and therefore they could be mass produced even by individuals or by companies. A little bit about COVID-19. It is mainly spread through respiratory droplets that are 5 to 10 micrometers large. These respiratory droplets can sometimes dry up and become smaller, or smaller particles can be borne through procedures such as intubation and bronchoscopies. These particles that are smaller than 3 to 5 micrometers can be identified as aerosols, and they can linger in the environment for up from minutes to hours and can have the capability of infecting individuals far longer than when they were produced. Some factors that affect mask effectiveness are their filtration properties of the construction material, quality of the seal between the face and the mask, the number of layers that the mask is made of, and the electrostatic properties of the construction material. Research has found that materials such as silk hold an electrostatic charge and so therefore are better at filtering pathogens. The flow rate of the measurement apparatus producing the particles also has a great deal of effect on the effectiveness of mask's filtration abilities, the temperature, the humidity, and the duration of use at which it is used. Some advantages of N95 respirators are that they are 95% effective at filtering greater than zero point 0.3 micrometers of particles. When fitted properly, they provide a tight fit around the wearer's face to prevent aerosol transmission. They can be fitted according to the size of an individual's face, and the individual can be thus tested for a proper fit. The disadvantages of N95 masks are that during the pandemic, you saw a surging of their price up to $8 a mask. And in some places in the United States, they even sold for $25 per mask. They need to be fitted properly to maintain a good seal. A decided disadvantage is that when you turn your head or when you're talking, it moves your chin, compromising the seal that the N95 mask forms with the face. Due to the great shortage, some healthcare professionals and facilities started using isopropyl alcohol to disinfect their masks, which reduced the mask's efficiency by 65%. They are required to be only used one time and therefore afterwards need to be properly handled and disposed of. If they are not disposed of properly, they can act as a fomite. Some research revolving N95 masks is that viral filtration efficiency, or the ability of a mask's ability to filter viruses, is 99.9% for droplets that are on average 6 micrometers or larger. This efficiency only drops by about 0.6% for droplets that are on average of 2.6 micrometers. The ratio of leakage of the mask seal increases by multiples. So if the mask doesn't form a good seal around the mouth, the amount of leakage that can occur is sevenfold greater for 0.04 micrometers and tenfold for 0.1 micrometers and a staggering 20-fold for a 1 micrometer. Surgical masks research shows that face seal leakage to filter ratio only ranged from about 4.8 to 5.8, and it was not significantly affected by the size of the particle. Duke University conducted a research where they tested 14 masks and they ranked them in from 1 to 14, and surgical masks were rated, surgical masks with 3 layers were rated at the top, with valved N95 masks following below, and polypropyl 2-layer propylene apron masks at number 4. As you can see, surgical masks are clear favorites in preventing viral transmission. Here, we would like to discuss some cloth masks' advantage. They are reusable, they are washable, they're economic, and can be constructed from home materials. They can have multiple, a person can have multiple masks at a time, and so they're able to easily interchange them every 4 hours without increasing waste or causing an economic burden. A decided advantage that cloth masks have over N95 masks is that they are washable, that they don't need to be used, cleansed with isopropyl alcohol, and thus using detergent or heat to kill or disinfect the masks won't compromise the material or integrity of the mask. Cloth masks such as bandanas and drapes or masks that have a single layer are the worst, and they can transmit as much as 97% of viruses. And these types of masks are highly recommended that you do not use them. All cloth masks tested were slightly inferior to N95 masks in filtering properties. Greater than 300 nanometers were superior for particles smaller than 300 nanometers. This is probably due to the fact that a compromised seal around the N95 mask causes a drastic increase in viral transmission. A study by Konda et al. Showed that an ill-fitting mask can reduce viral filtration efficiency by 60%. Another study showed that 15 to 50% increase in efficiency of a mask with a nylon stocking around the layer that covers the edges of the mask. This provides a greater flow of air around the masks and thus reduces the viral transmission. Some conclusions that we can draw, therefore, are that if proper precautions are taken, cloth masks can achieve up to 90% efficiency at preventing droplet penetration. With an adequate seal for particles larger than 300 nanometers, cloth masks offer a similar viral filtration efficiency to surgical masks for particles larger than 6 micrometers. Cloth masks, however, are not a suitable option for protection against aerosols. So therefore, we would recommend that healthcare professionals not use them until further research is done on the matter and there is more supporting evidence on the effectiveness of cloth masks. These are the references, and thank you for listening.